My name's Lauren Kenny. I'm the Clinical Quality Manager for Renaissance Care. Renaissance Care are a care home company in Scotland. We provide care to over 750 residents across Scotland. We have over 75% of our residents in our care homes that live with a cognitive impairment. And that brings its own challenges in terms of them being able to communicate that pain, the number of stress and distress reactions that we have, challenges in terms of residents eating, high risk of falls, all these things that are added together that make things a lot more challenging in care home environment to provide care for residents. The pain assessments that we did prior to using PainChek were paper-based, and we used the Abbey Pain Scale. This was very subjective. It was just the nurse and staff that carried out those assessments and then the follow-ups. So we were never getting a true accurate reading of what someone's pain was and how well that was being managed. So we were looking for something a bit more accurate. Nowadays, using PainChek, any staff member can carry out that assessment as long as they've had training on it, and that can be followed up then with the nurse and staff afterwards. But yes, it's a lot quicker, it's a lot easier to use, and it's a lot more accurate. So we decided as a company to start using PainChek after we had one of our services take part in a trial in Lothian, and we noted the improvement and the positive outcomes that had had for our residents and for the staff. We had had a number of complaints prior to using PainChek regarding pain management in care homes, specifically regarding end-of-life care, and it's something that the company wanted to address. We have had some fantastic outcomes for our residents with the use of PainChek. We have seen a number of residents' medications being reviewed by professionals, reducing the number of analgesia or the amount of analgesia that they're prescribed. We have seen a reduction in some falls, and we're currently looking at that further in depth, but we are seeing residents participating in activities more. We're seeing residents mobilising better because we are effectively managing their pain now. In the care sector, we can often see residents having or experiencing stress and distress behaviours as an unmet need, and that would often lead to residents being prescribed or administered some antipsychotic medications. What we're trying to do here at Renaissance Care is to better identify pain management for those residents and assessing them and identifying that actually that unmet need may be pain, and therefore we are starting to see a reduction in the number of antipsychotics that we are administering to our residents. The biggest achievement that we've had in Renaissance Care, and that I'm so proud of Renaissance for, is the number of assessments that we are completing on a monthly basis. We started off when we were using PainChek completing 400 or 500 assessments per month, and at present we completed 12,000 last month. So just the way that the staff have taken it on, have really embraced the technology, are behind that, how they have really accepted the use of PainChek in the homes, and it's now very much embedded practice in the care homes. The management team absolutely love PainChek. They are very invested in digital care planning, digital assessments, pain assessments. They're very invested in that, and they very much want to move with the times. The feedback, when you see the stats coming back in of how many assessments are being done, and we start seeing some of those positive outcomes for the residents, the leadership team are over the moon with that. Care Inspectorate have really taken PainChek on in their inspections recently. They are fully on board with the digital pain assessments. They like the fact that the staff have access to the portal so they can see trends, they can look at the analysis for residents, they can look at trends in their home. It has definitely taken shape, and the feedback, it's led us to getting 5s and 6s in some services because of the pain assessments and the overall resident wellbeing. In my opinion, PainChek is the front runner and should be leading best practice for digital pain assessments in Scotland. We are starting to see residents participating in activities more. We see residents mobilising more, coming out their shell a bit more. We're seeing less stress and distress reactions happening across the board. So yeah, there's been some really good outcomes for our residents.